Hello, my name is Nicolás Merritt and I'm a student in Indiana State University's Doctor of Athletic Training program, and today I'll be going through a progression of traditional exercises that I've created for a gymnast who is returning back into rings activity. So first we'll have the individual go through an open range of motion with their shoulder to return back for that posterior lateral instability. So you're going to go through a pendulum, going down, making sure that that open range is available for the individual. And you're going to have them do that about 10 seconds and do that a set of 2 times and rep for 2 reps. So 10 seconds around and switch and change directions and do that bilaterally. Then we'll have the individual go through an abduction measure. They'll go and choose one side, make sure that the shoulders are rolled back and tucked down, and activating the posterior area of the shoulder, and go through abduction of the shoulder up as high as possible, pain-free, and then return back to center. Then we're going to have them go through a tricep push-up. So have the individual sit down supine on the ground. And we're going to go through a tricep push-up where the main goal is to have an activation of the tricep and an activation of the pecs and the deltoid at the same time. So here we're going to have the elbows bend slightly just to allow some motion at the shoulder, but mainly the stability portion and isometric contraction at the shoulder, and then come back down and up. Then we'll also increase the difficulty of this exercise by having the patient straighten their knees to increase the amount of load and change the center of gravity. Once the patient is pretty much comfortable with the range of motion and stability exercises, we'll move to something a little bit more dynamic by adding in a shirt or towel on a tile floor to allow a little bit more movement for the shoulder. So at this point, they'll go through the exact same exercise as before, going through with the knees bent, and there's going to be a little bit more movement, and now we're going to increase and go through that abduction measure at the same time. So we're trying to get that same contraction that we would on the rings, getting the body to lift up, except we're taking out a lot of the gravity portion and the full body portion at this point. So then we'll increase the amount of weight and load by changing the center of gravity and straightening the individual's legs. Here they're going to focus on stabilizing their core and trying to keep their core tight, as well as lifting their legs a little bit off the ground and increasing the abduction measure to push out and stabilize their body. Once they're pretty much comfortable with this, you can start going into range of motion on the rings, having them go through their progression again, and hopefully they'll get back into their regular activity.